All right. Well, good evening, Dr. Ojo Cairns.
Hi everyone.
How you doing tonight?
I'm good. How are you?
Better now that I'm here. We're here tonight. We phrased it as pain with sex. And what's funny is the whole day I've been thinking, why don't we say sex without pain? Because there's so much that's framed around negativity, but really
Mhm.
like this whole chat is about the fact that there's a solution. There are
To
ways
have
to go
to
about
have
it
yeah, okay,
differently.
yeah, I see half glass full.
Yeah, sex without pain.
Today I drank 64 ounces of water. So I'm measuring my water. And I
Hey-oh.
thought it is better in that instance to say half glass empty.
So it's all about your
It's
perspective,
all
about
your
how you're looking at the glass and what's in the glass, I think is another thing.
it was water.
Well, I
It was
mean,
water.
well, I'm proud of you.
Thank
I
you.
did not
Thank
get that
you.
much water in, but I'm hopeful. Tomorrow's a new day.
Thank you. Shout out to my friend Ada for hooking me up with that big bottle. You see, I have a little friend here. Okay.
Children are integral to this topic anyway.
Yeah, well, they're oftentimes products of it.
Actually, that is the moment in my life that I experienced the most pain with sex was
Hmm.
when I was trying to get pregnant.
Hmm.
And in reflection now, in preparation for this, I realized I did not tell a family member. I did not tell a friend. I did not
Hmm.
talk to my doctor about it.
Hmm.
I just, I don't know. I knew it wasn't normal, but I don't know. I don't know what it was that made me not try and figure out a different way to go about it.
Yeah. Why do you think you didn't talk to anyone?
I think part of it is it's embarrassing. And
Okay.
I think
Yeah.
I also recognized that it was, for me, it was my endometriosis that was a
Yeah.
large, and my solution for endometriosis, this was pre medical treatments, was to get pregnant.
Okay.
So
Yeah.
the way through the pain was through the
Yeah.
pain,
Yeah. Yeah.
which made it really unpleasant and probably very traumatic for my husband.
Yeah. Well, but it is common. And you're right, endometriosis is one of the most common causes. I wonder if it's also likely the most well known, I would think, because endometriosis itself is pretty,
She's a busy woman.
I
She's
know,
got things to do.
sorry. But I think it's, because endometriosis itself is pretty well known. And so I would say that's probably the most well known cause of painful sex. I'm trying to think of a different way to say it.
Mm-hmm. Mm-hmm.
But definitely not the only. And I think it is really important to be open because with being open, you have a better opportunity to be heard and to gain insight and help.
Mm-hmm.
And so being open not only with your doctor, but with your friends, family members, probably the most important person to be open with is your partner.
Mm-hmm. I was very open with my partner. I think it feels like, I think I felt, if I'm going to be really just honest, like there was something wrong with us.
Okay. Yeah.
Like it
Hmm.
meant something about our relationship, which
Yeah.
in fact, I'm sure, I don't think it did
Yeah.
ultimately.
Yeah. Well, I mean, it itself can cause issues in the relationship. It can cause problems in the relationship. Especially if it's physical, it's not the root cause. Often, there's some instances where, yeah, it may be the cause, but if it's not addressed and discussed, it can definitely cause issues. And so that's a challenge. That's a challenge. And so it's being open and forthcoming. And then that being forthcoming is also not only about the symptoms or the pain, but what you need. You know,
Mm-hmm.
um, Oftentimes it occurs because there's not enough vaginal lubrication. And so vaginal lubrication itself oftentimes is a lack of that, oftentimes is directly caused by um, issues with libido, issues with stimulation, and so on. And so, even just having a conversation about, okay, how do we have sex? What do we do before we actually engage in any type of penetrative sex with foreplay? How do we have conversations with one another so I feel more connected to you, so I feel more attracted to you when we're having sex? That those
Mm-hmm.
things can actually even help to increase lubrication because you have more desire. So definitely discussion is something that's really important. We can go down the list, I think, and it's a good idea to go down the list of some of just the organic causes of painful sex, endometriosis being one. And so those implants can implant in areas in which when you're having sex, if it's hit or touched, you can have pain. There are different vaginal conditions, and so I'm going to throw out some terms here, maybe more challenging, but I'll explain them. Vaginismus, vulvodynia. Vaginismus is a condition where the muscles involuntarily contract when touched. Oftentimes that occurs because of some psychosocial issues or those types of issues. Vulvodynia is a condition where touch around the vulva, which includes the mons, so outside the vagina, the labia, the clitoris, touch is perceived as pain because pain pathways have changed. So that's often caused by like an inflammatory response. Endometriosis can be one. There are oftentimes women with both vaginismus and vulvodynia who have endometriosis, and so it's that pain pathway that has occurred. Infections can cause painful sex because the area is inflamed due to the infection. Recent surgery, you would think recent surgery, you need to heal from the surgery. You have sex a little bit too early, you definitely can have painful sex. We've talked about menopause and vaginal dryness that can cause painful sex too. So there are many structural and organic causes. I didn't mention ovarian cysts, fibroids. Those things can cause painful sex. So those things, so those are the reasons that it's important to be open about your symptoms. Definitely discussing it. You may not have other symptoms for those conditions, but painful sex would be a gateway that you and your physician could go through to discuss how to treat, what treatment plans would work for you.
And now I just have to ask, is there anything positionally, I guess it depends on what is causing that pain and what you enjoy out of your sex life, but positionally, is there anything that people should consider?
So, definitely female dominant positions are more comfortable than male dominant positions because you have more control. And so female dominant positions can include the woman on top, even coupling, so both partners on the side, more comfortable. Male dominant positions with the male on top or the male behind can be more painful. And so that definitely can, because some of these structural issues can be hit during sex. The cervix, during a male dominant position, there's more chances, especially with deep penetration, that the penis can hit the cervix and that can cause pain. So definitely female dominant positions, use of lubricants, use of a good lubricant that mimics your own vaginal lubrication is good.
Speaking of which, have you got any particular do's or any particular don'ts in terms of lubrication?
Yes. Using something that's aloe-based, water-based is better than an oil-based lubricant. Your vaginal mucosa absorbs it a lot better, and so it's it becomes almost like a humectant, so a moisturizer. So I recommend products like Good Clean Love. They have a really good lubricant. Aloe vera gel even works well as a lubricant. I wouldn't use oils, coconut oil. I hear that often. Olive oil. I hear that often. Those I think steer away from. Those types of using that as a lubricant, there's always the risk of those being rancid, spoiled. So the shelf life is a bit different. Some people use saliva as a lubricant. And so, of course, good hygiene is necessary. But, that would go back to, also discussing foreplay and different types of sex. Penetrative sex is definitely not the only type of sex. And so if you find that penetrative sex is more uncomfortable, oral sex is an option, and the clitoral stimulation is an option. So considering all forms of sexual interaction with your partner and finding not only works so that it decreases the amount of pain that you have where is pain-free, but also where you two are bonding.
I love how you started with that, just about having a conversation beforehand, things like that, because, you turn on the TV sometimes, or it just feels like our culture is so driven toward that like end goal, and that end goal looking one certain way when there are so many different options where you could veer off that main course.
Yeah. And, the conversation I don't think has to take place like while you're in the bed. Like, you should be feel in your relationship secure enough to have a conversation that's open like that. And at any point, that you have private time with one another. And sex it really shouldn't just be about the act, but it's the intimacy that brings along that, comes along with it. And so being on a level with your partner where you're that intimate to where you feel comfortable enough to share your own personal desires and needs, I think is a goal to have in your relationship. And so, go ahead. Now, I was going to say, not to jump ahead, but this leads directly into our discussion for next week about libido and what are the causes of, what is libido? That's the first thing. And what are the causes of a lack or decrease in libido? And some of those causes is just, a lack of communication between partners.
And I am so excited that we're going to be joined that conversation with Dr. Annkarcher, who is a sex therapist. I'd heard that title kind of abstractly, but never spoken to one. And I'm very excited for her to be here. That's going to be a great conversation. So if you've got questions and you want to keep them anonymous, please send them to us on any of the social platforms. You can direct message us. If you want to keep it anonymous, we're happy to ask those for you. I'm very, very excited for that conversation. And I had so many questions at once in my head that it feels like my brain is buffering. Oh, I know. I know this is going to sound silly asking out loud, but maybe somebody else out there is thinking it. When I'm speaking to you now, I know we're live, but it feels very intimate and it feels very like you're taking it seriously and not having any judgment on the situation. And that's how I would hope that conversation would go with my gynecologist. But I think that there is some sort of deep fear in me that there would be some sort of conversation. I know that there's Hipaa and you're not allowed to speak about patients, but that there would be some sort of like that you might then go mention it to somebody else if I said something that I was very, very sensitive. It's a very sensitive topic for people. So I'm sure that you don't do this, but I just felt like I would bring it up in case anyone was worried about having these conversations, lest they be then discussed further.
Yes, all of your conversations with your practitioner are protected by Hipaa. And so you should feel comfortable speaking about anything. Again, speaking openly is what allows you to have good healthcare, I think. And so that openly and honestly, because there's no way that you can be treated completely without the person knowing exactly what's going on. And so, everyone has different comfort levels with sex. And it may just be because of the profession and because what I deal with on a day-to-day. But in my mind, sexual relationships, your sexual health is just as important as your mental health. It's just important as your physical health. And so it should be taken seriously and it should be addressed seriously. And so whatever conversation occurs stays in the room. Whatever conversation occurs should not be judged.
And is there anything for people who are less comfortable with that conversation that they could do to prepare for that conversation with their gynecologist?
I personally think writing things down allows one to clearly state what their thoughts are, and to be able to get your point across clearly. And may also give a bit of of security, and also make a person feel a little bit more courage in asking the question, because it makes it a bit more official, you know. And so I do encourage patients to write things down. Also encourage patients to write things down, because sometimes people don't want to voice. It's kind of hard to voice it. You know, you may feel a bit timid. So to write it down and hand it to me, I don't mind reading it, you know, and then I will bring back the answer to you, you know, vocally. But sometimes I feel that makes it a bit less intimidating. And so I think doing that, but also really just understanding that your satisfaction sexually is important. It's important to your health. If you are someone who wants to have sex, if you're someone who, you know, because that is part of life. There's nothing wrong with it. There's nothing abnormal, you know, and we should not consider as such. It's not the same as in the movies, right? And so we shouldn't be making goals that are not realistic. We should also address it and discuss it in a different way.
I love that. Well, I'm very excited because it feels like in this particular episode, and especially with next week, we're touching on something that might be sensitive to people to bring up, but hopefully in hearing this conversation and being able to anonymously participate with questions and hearing two other people talk about it, hopefully that helps to kind of start the mind in that direction.
Yeah,
because it is so important.
And I'll say this again, you know, problems with sex may occur because you have other health problems. And so being open with about that with your GYN allows your GYN to really, excuse me, understand and know how your body functions, and may help them have a bit more insight on your gynecological health. And so it's not a bad thing to say, hey, every time I have sex with my partner, I have a huge pain in my lower left abdomen. That would tell me, hey, I need to get an ultrasound. She may have a huge cyst or mass on her ovary, or she may have something going on with her uterus. You know, so that it just allows your practitioner to have a bit more information for diagnosis. And I think that's important.
Yeah, that's great. I didn't think about it from that perspective, tied up as I was in my own web of embarrassment. Guys, thank you so much for joining us tonight. It's just been a quick dip, but if you have other questions or if we can expand on this topic, we'd love to revisit anything that's of interest to you. So feel free to toss us those questions in a direct message. And join us next week as we have Dr. Karcher, who is a sex therapist, who will be joining us to talk about low libido. What is it? How to know if you have it? How to move beyond it if you so desire. Thanks, everyone, for being here.
Thanks. And again, anonymous questions, just send it to us beforehand, and we're happy to ask them for you.
Good night, everyone.
Good night.